Welcome back. The COVID pandemic has taken a toll on all of us, and we can't forget those who are on the front lines, staffing our hospitals and medical centers. A recent survey finds that up to 93% of those frontline workers have experienced stress as a result of COVID-19. And to talk more tonight about this finding, I'm joined by Paul Gionfriddo, who's the CEO of Mental Health America. Mr. Gionfriddo joins me tonight from Connecticut. Sir, thanks for being here. What made you decide you wanted to do this survey?
Well, we knew a lot of people were paying attention to the physical health aspects of the pandemic and what the physical toll might be on healthcare workers, in particular with the virus. But we thought too little attention was being paid to the toll on the emotional health of frontline workers. And so we decided that we would ask them how they were feeling and how they were doing.
So then what were some of the results?
Not surprisingly, they're not doing very well. 93% said they're really feeling a lot of stress, 86% anxiety. 82% said they're feeling emotionally exhausted, compared to 68% who said they were feeling physically exhausted. So the mental health toll on our frontline workers is just extraordinary and deep as a result of this pandemic. There are some baseline studies that we have done and have broken out healthcare workers compared to other professions, particularly in service industries and also in non-service industries. And while traditionally a lot of people will report a significant amount of stress, it's never been to this level, and it's never been distinguished among healthcare workers to this extent. So we've learned some new information here about how stressful this work is, and again, how deeply it's impacting people. They self-select into it because they're caring and compassionate people. And so part of the stigma is that to turn around and be the one who's on the receiving side for somebody whose nature is to be on the giving side is really stigmatizing in a certain way for people, but not in the way that we would typically use the word. And then there is also the question about, I'm supposed to be strong and I'm supposed to take care of other people. And even though I'm feeling sad right now, and even though I'm feeling stressed right now, I'm supposed to be strong and I'm not supposed to show weakness. Asking for help may be a sign of weakness. It's not, it's a sign of strength, but that's not the way people feel.
What are some of the tangible things that we can do to help those healthcare workers on the front lines going through this extraordinary time?
Well, I think we need to make certain that they can take advantage of employee assistance programs while on the job and get informal supports while on the job as well. I think when off the job, those of us who are taken care of by them need to just step up and do a little more of the caretaking and caregiving, at home. And also, we just need to give them, like everybody else, information and resources that they can use as they need to use them. And so we're offering it on mhanational.org with the /frontline, a whole new set of resources to provide support for frontline workers that they can take advantage of and use at their leisure. About half of them, have told us they're questioning whether or not they want to stay in the industry, and that's kind of across the board. And so that's a real concern because of what it may do to our healthcare delivery system moving forward, a delivery system which is already stressed. But, the other side of what to do really is to recognize that we do need to take care of our workers. We've kind of taken them for granted. We call them heroes, but we don't treat them as if they're heroes. And we're not giving them the time to themselves they need. We're not asking them what supports we can give them. We're not providing them the emotional supports they're asking for. And we need to be doing all of these things as a matter of course, if we want to get through this, because even with a vaccine right around the corner for healthcare workers, we're really only halfway through the emotional and physical stress we're going to be putting on them to care for the rest of us into the spring and summer.
All right, Paul Gionfriddo from Mental Health America. Sir, thank you very much for your time. Really important topic.
Well, thank you very much.
And we'll be back after this.